All right. Well, welcome everyone to the September PFCC Partners Workshop. I'm really excited to bring this topic to all of you today. Our team at PFCC Partners has been talking a lot about kind of what's been going on in our country.
It went very well. It turns out that this is
and really how we can be part of the solution. Quick reminder to mute your lines. We'll have plenty of time for discussion as we get through our workshop today. We have a little bit of content up first, but then I really want to kind of invite everyone into the conversation. And I would love to hear your ideas and what you're doing to really support our health systems and our communities at this kind of continued trying time. Today, I am really excited to welcome two of our partners from the Cynosure Hospital Quality Improvement Contractor from Louisiana. We have Libby Airhart, who is the program coordinator of the CFC International and also a patient family partner on the Cynosure HQIC Patient Family Partnership Council, and Michelle Smith, who is the quality program manager at the Louisiana Hospital Association. And I really invited both of them to kind of share what's been going on in their state and really start the discussion about resiliency. How can we be resilient as individuals, as a community, as healthcare workers, as health systems at this time? I am Lindsey Galli. I'm the Director of Education for PFCC Partners. I will be facilitating our workshop today, facilitating the discussion with Libby and Michelle, and then a discussion with all of you. I really want to welcome you and hear your thoughts, ideas, and things that you have been doing also. And so, yeah, just another reminder about Zoom. I know Zoom has updated since I've done this slide, but just a reminder to mute your lines if you have any background noise or anything else going on. And turn your videos off too if you're walking around the house. Don't take us anywhere you wouldn't want to take your colleagues in your house. We do have Laura Jackson on. She's our community director at PFCC Partners, helping me out behind the scenes, muting and turning cameras off when necessary. So thank you, Laura. And then during our discussion later, if you would like to raise your hand, I know that this has been updated on Zoom. So on your toolbars now, if you hover over your screen that has the mute button and everything else on there, there's a little reactions button. And that reaction button has a little hand that you can put up, and that will let me know that you would like to come off mute during our discussion and ask a question or just raise an idea as well. And if everybody wants to try that, you can do your favorite emoji using the reactions button. All right, we got a little party with Kathy. Thumbs up from Dr. H. Awesome. We got some laughs and hearts, some surprises. Awesome. Okay. Well, please use those to let me know that you would like to come off mute during our discussion. Thank you. And also please use the chat box all throughout this session. If you have questions as they come up, please put them in the chat box and we'll get to them when we do get to Q&A and discussion later on. So who are we? We are PFCC Partners. We're a patient-driven organization. We all serve in the role of patient family advisor, anywhere from our local hospitals to national partnerships. And we really utilize our experiences in the healthcare systems as patients and families and patient family advisors to support the partnership of healthcare providers and patients and family caregivers, because we know that the best possible health outcomes happen there in that collaboration. And so we have a vision to reinvent the healthcare industry so that all stakeholders can continuously partner with empowered patients and families as a resource in the co-design of programs, policies, and quality improvement activities. And that vision is one of the reasons why I wanted to bring this conversation to our community. Really, how can we collaborate and continue to partner with healthcare and healthcare with patients and families to really help to bring more resiliency to the state of kind of what is going on in our country right now. And so this is how we work. Again, we're all patient family advisors. We use those experiences to develop structures and cultures within health systems, and then to support patient family advisors as well. And all of that support goes up to the healthcare organizations that we partner with continuously to ensure that they are really creating authentic and sustainable partnerships with patients and family caregivers. And one of those healthcare organizations is Cynosure HQIC, where we're working with over 300 hospitals within 11 states, one of them being Louisiana, which is why I'm so happy that Michelle and Libby were able to join us for the discussion today. Oops. We also fully support the Patient Family Advisor Network. This is a community of highly engaged patient family advisors that grows each of its members' competencies and partnering to co-design effective healthcare systems, processes, and policies by connecting them with a community of other patient family advisors, presenting free skills exchange opportunities to really learn the skills needed to partner effectively, and then get connected to engagement opportunities all across the country. And if you aren't a patient family advisor in the PFA network yet, I'll ask Laura to put the link in to join us. And before we get to our topic for today, I just wanted to do a plug for our October workshop next month. We will be joined by Andrea Meinhardt, Dana Dembski, and Rosie Bartel, who will be joining us from Epic. They'll be talking about Epic MyChart and patient-centered care, really talking about how they have incorporated the patients and family caregivers into the design of Epic MyChart. So that will be coming soon in October. Okay, so as we kick off our main discussion today, I first just wanted to really thank and share gratitude for all of the healthcare workers out there, from our administration to the front line. I thank you for your continued efforts to kind of show up every day. We absolutely do see that. And I can understand the positions that healthcare workers are in right now. It's got to be difficult, but you keep showing up through fear, anger, tears, whatever it might be. So on behalf of the Patient Family Advisor Network, I just wanted to say thank you. I will share this gratitude video. We actually made this, I guess, a little less than a year ago. But I think it is still just as fitting today as it was then. So a great video from the Patient Family Advisor Networks, just patients and family caregivers sharing their gratitude for healthcare workers. And if this is something that can kind of push somebody forward, get somebody through the next day, then we absolutely welcome you to pass it along. So thank you. And to jump right in, I wanted to first talk about kind of what's going on right now. And first looking at COVID-19 vaccination rates across the country. This map is from the CDC, and it is from, I grabbed it yesterday, so September 3rd. So it's pretty up to date. But I wanted to click into it and let me bring my screen over here. I'm sure a lot of people have already kind of dove into this, but if you haven't, this is a really interesting map of a few different things that you can look at. So when you go on it, we have first, there's the data type, and you can look at a few different things. This is showing the level of community transmission. Obviously high all across the country. But then we can start to look at cases, hospital utilizations, and I was really interested in vaccinations. And so when we click it, and it might be slow because there might be tons of other people on here as well. But so we can see kind of, here's the key down here, but vaccination rates per county. And you can kind of go and look at your county, look at your state, and really just assess kind of where vaccination rates are and what might be missing. Actually, that's interesting. Yesterday, there weren't any Idaho data here, and now there is. So that's kind of cool. But then you can look at different metrics. So you can look at the total population with 1 dose, different ages, and then fully vaccinated as well. And the one thing that I thought was really interesting and something we learned earlier this week was Puerto Rico down here. It has the highest vaccination rates, I think, compared to Maine. I think they have the highest vaccination rates when it comes to 1 dose. And what we learned was because they have such a huge sense of community and they want to take care of each other and take care of their elders. And so they have gotten the vaccine, and the community has gotten the vaccine in order to do that, to be supportive of the community as a whole. And so I just thought that was really interesting and just wanted to bring this resource to all of you. And we know that there is a lot of information and misinformation out there about the COVID-19 vaccine. And I'm really curious, what is the most unexpected thing that you have heard about the COVID-19 vaccine? So you can chat in or speak up. I will start because I have a sister-in-law who refuses to get the vaccine, and it's because she really does think that there is some sort of chip that is connected to 5G and that will be able to be tracked. And she really does believe that. And that has been the most unexpected thing. Someone that's so close to me that I had no idea that they thought this way. It's just been really unexpected. And personally, a little disheartening. So please, yeah, chat in. I'm really interested to hear some of those unexpected things that you've heard. You can come off mute and share as well. Lynn, Bill Gates put in a nanobot into the vaccine to track. Okay, so similar to the chip. Christina, yes, I've heard I won't be able to get pregnant if I get the vaccine. Yeah, there's been a lot of infertility information out there. Absolutely, the tracking aspect, I think that's been the most unexpected. The sterilization, the changing the DNA, that was another one that I heard, Michelle. Yeah. Mike, I would like to know how a chip can get through a needle. Well, apparently it's microscopic. Will cause birth defects. Raj, my barber asked barber went silent to hear my 2 cents. Do you think they are tracking us? Okay, causing autoimmune disease. Yeah, so there is a lot of information out there. Misinformation and information in itself. But thanks all for sharing what you have heard and what has been unexpected from you. Bill, that's hilarious. Bill says, I hope it is a tracking chip, so if I get memory loss, they will find me. Oh, that's good. Thank you for the giggle. And see, I think that is part of being able to be resilient at this time. It's being able to have a little lightness, a little lightheartedness. And so thank you, Bill, for bringing that. Yes, Mary, you do have to look at the upside. Absolutely, every day. And before we get to the upside, I want to share the downside. This is a video from Dr. Catherine O'Neill. She is a chief medical officer and an infectious disease specialist at Our Lady of the Lake in Louisiana. This has been a pretty popular video, and I just wanted to bring it to all of you. And again, all of these links and things that I'm sharing, we will share out after the session today. And I saw a question, Harvey. Sorry, we have to watch this ad.
That look. That look is a look that can only happen by a roaring fire.
At least yeah. Okay, I'm gonna reshare my screen just so you all can hear it.
I'm Dr. Katie O'Neill. I'm an associate professor of clinical medicine with LSU, and I'm the chief medical officer at Our Lady of the Lake here in Baton Rouge. 2 weeks ago, we stood here, just over 2 weeks ago, with 36 COVID-19 patients in the hospital. Today, we have 155, which is our max from last April in 2020. It doesn't sound like a lot, honestly, when you think about numbers. But we are the largest hospital in the state. We have almost 800 beds. We have 713 people admitted today. And no one diagnosis should take up 1/4 of your hospital. It doesn't happen. It's not imaginable, except for now. And we can't tolerate it because it's putting an incredible pressure on the rest of our patients and our hospital staff. When I left the hospital earlier, there were 23 patients on the board waiting for a transfer into our hospital for an ICU bed. Those are the ones that I looked at first. There's no reason to even look at the med-surg beds. They're never going to get here. But you look at every single one of those ICU beds and you spend all day trying to figure out how you can staff another one. Those are 23 people sitting in an ER somewhere. Many of those ERs are not attached to a hospital at all. There is only an ER physician. Many of those ERs are attached to a hospital that does not have a critical care doctor or a subspecialty cardiologist or a subspecialty surgeon. You have people with chest pain sitting in an ER right now where their families sit in the waiting room and they are wringing their hands and they're calling everybody they know. Do you know somebody who works at the lake? Can they get me in? Do you know somebody who works at Oxnard? Can they get me in? And they will do that for days. And that patient will lose muscle. They will lose years of their life, but they will stay in that ER because there are no more beds left. Those 23 patients are a glimpse of what we have been doing for the last 2 weeks while we have been trying to get everybody vaccinated. And it's not helping enough because it's not happening fast enough. And when you come inside our walls, it is quite obvious to you that these are the darkest days of this pandemic. We are no longer giving adequate care to patients. That is also stopped. And you heard from each of these physicians that we no longer think we're giving adequate care to anybody because these are the darkest days of the pandemic. How do I get those patients to this hospital? How do I open beds? Vaccination is going to get us there, but it will not get us there fast enough, and we will lose our friends and our colleagues because of it. But if we put on our masks, as we've done through the last several surges, we will see a decrease in hospitalizations again, and that will give us time for the vaccinated to work. Those who got vaccinated in the last 2 weeks already have protection, and I doubt that I will ever see them in our hospital due to COVID-19. And if you get vaccinated today and you mask up, I doubt that I'll ever see you. Yesterday, I drove down 190, which is one of my favorite drives. And we got to see some rice being cut, which my father's a farmer, so that is one of my favorite scenes. We drove behind some people who were driving motorcycles, and it was the end of the day, so it was tolerable. We drove past some kids who were on their four-wheelers. Looked like they were having a great time. Usually that is an incredibly enjoyable drive, and all I could think about was that I have seen people in four-wheeler accidents and motorcycle accidents and farming accidents in the last 2 weeks who sat in their ERs in their small towns. Those are my people. Those are your family members. And when they get maimed today, they're not coming to a trauma center because there are no more beds. We have 67 empty beds in our hospital because we can't find any staff. We have a federal unit on the ground who usually I meet at the PMAC during a hurricane, but now they're inside our hospital and we can't even open beds with them because so many of our staff are out with COVID-19. We are out of things in our pocket to open beds. We need you to open our beds for us. Please do that by getting vaccinated today, which will help us open beds in the next several weeks, and by putting your mask on today, which will help us open beds soon. How soon? I don't know. We've never used a combination of masking and vaccination. We've always had to shut down other things, and we're not going to do that this time. We're going to ask you to vaccinate and to mask instead. But if we all do it right now, our numbers will be better, our beds will open, and we will gladly take the baton back from you and start to work on opening our beds ourselves. But right now we need you to do that for us. We're asking everybody in every single parish all over Louisiana today to put your mask on and to go get a vaccine. Thank you.
All right, so pretty powerful stuff. And I saw, Bill, your comment in there, hearing the doctors and their stories and how disheartening they were. And I think we talk a lot about stories, and that's really the heart of all the data that we're seeing out there. It's within these stories, like Dr. Katie has shared. And we've heard a lot of stories ourselves about healthcare staff burnout and staff shortage, and the fear and the anger of not just the healthcare staff, but the anger of patients and families who aren't getting that adequate care that Dr. Katie is talking about, and the lack of resources and those 67 beds because they can't find staff to work. And so I share this to prompt all of us to get to thinking, how can we build resiliency together? And so at this time, and I already see some great ideas coming in there. So thank you all for chatting in and speaking up. But welcome to Louisiana. And I want to welcome Libby Airhart, who again is the program coordinator for the CFC International and also a patient family partner on our Cynosure HQIC Patient Family Partnership Council, and Michelle Smith, who's the quality program manager for Louisiana Hospital Association. And I just have a few questions for both of them just to learn more about their own experiences, what they're hearing in the community, and their ideas for how we can help the health systems and communities recover, not just from COVID, but from everything else that's been going on in Louisiana with the hurricanes. And yeah, so I think I'll start with Libby. I'm curious, how have you and other community members managed this current crisis?
Hello, everybody. So I think we've done really fairly well. We live in a very, very small town here in Louisiana, very small. And we don't have many issues with following the guidelines. Like, I don't really see that a lot of people or not wearing their masks or give a lot of trouble, for wearing their mask. So our community here really has rallied and done their part in, at least wearing facial coverings outside and during activities and things like that. And I think they've done pretty well. So that's how we're doing. Now for other cities, bigger, widespread, since I do work for an ambulance company as an EMT, as my primary job, that's not the case. It is so rampant. It is so rampant. And again, I think that video of Dr. O'Neill was a couple weeks ago, maybe even a month or two ago. And I still can tell you from the inside that there are still no beds. There are still not a place to put people. There are still people sitting in ERs. There are still people that have gunshot wounds that we simply cannot move them. So it is definitely affecting everyone still. But as for our little community, I think we're doing okay here.
Great. Thanks, Libby. And I'd like to invite Michelle too, because I know you have a different perspective, and I'm curious how, from what you've seen, how hospital staff and other healthcare workers are managing this current crisis.
Well, and Lindsay, I think we probably need to put a little bit of perspective of the COVID situation, in addition to what Louisiana has gone through over the past year and a half, in addition to COVID. So just if you'll bear with me a little bit. So New Orleans, and thanks to Mardi Gras 2020, they were one of the original hotspots. And so after that, the COVID quickly spread throughout the state. And we are currently coming out of our fourth surge. So as Libby said, the numbers are still bad, but they are way better than they were pre-Ida, which seems like it was so long ago, but it really was maybe a month ago or 3 weeks ago. So we are getting better. Our vaccination numbers are getting better. They're neither one or where they need to be, but they are better than what we were. So to put the tropical side into perspective, so Louisiana hospitals and residents fell in what we refer to as the cone of uncertainty. And when I see your little sign here, I was like, oh, I should have sent you the cone of uncertainty, because that was the thing last year, was they kind of replaced the welcome to Louisiana sign on the interstate with welcome to the cone of uncertainty, because we fell into that tropical eye 8 times, and which meant our hospitals had to prepare 8 times for a direct landfall. We experienced 5 direct landfalls. 3 of those were hurricanes. 2 of those hit the same area, almost exactly the same pinpoint location when they came to land, which is Southwest Louisiana, our Lake Charles area. And that was during a surge. So our hospitals have been through this scenario before of during a surge having to prepare for the tropical disaster that's forthcoming. So in 2021, we've had 2 landfalls. One was a tropical system, and then the other was a category 4 Hurricane Ida. And as I said, that was during a fourth COVID surge. We were at capacity. We had over 3,000, between 3,000 and 3,100 COVID patients in the hospitals. And we've had to evacuate 13 hospitals at that time. And 4 of them are closed. Some longer than others is the projection, but imagine when you're already full, having to take 13 hospitals and put them somewhere, because that's what we had to do. When Ida was approaching, we had, as I said, we were over capacity. Let me rephrase that. They evacuated those most critical patients because they didn't have a place to put all of the patients. So they took the most critical and put them somewhere. And we are so grateful that other hospitals made accommodations to be able to absorb those when they were at capacity. In preparation of the storm approaching, the hospitals were able to discharge down about 2,700 COVID patients in the hospital. So they were able to discharge some people back to where they could safely be taken care of. But after Ida hit, we had one hospital in our Bayou region that was responsible for over 200,000 people. And why do we have that? Because the other hospitals were completely taken down, not structurally taken down, but they either lost roofs or they lost walls, they lost power, they lost water. So that one hospital, who was functioning on 100% generator power, was responsible for those 200,000 people in that area. From a collaborative effort, they opened up multiple DMAT, which are the disaster medical assistant teams in that region. They also opened up one that's called a CERFP, which is a National Guard version of a DMAT, to help provide some support, medical support. So when you approached me about, coming and speaking to the workshop about, collaboration and resiliency, we've had to do that more than most in Louisiana. We've had to do that. It's the only way we've survived. We are a resilient bunch. We figure out how to make things work, and we figure out how to support others, because what we know is there's always somebody who's worse off than we are. Not necessarily another state or another area, but as an individual, I know, yes, we may have lost power, we may have lost water, we may have lost these things, but there's people that lost everything, including some lives of people they know. So I just wanted to put a little bit of context, because people tend to forget in other parts of the country the magnitude of what we've lived through as a state in the last year and a half, in addition to COVID.
Absolutely. I really appreciate that context, Michelle. And I mean, yeah, exactly like you said. And that's exactly why I wanted to ask you, because of the position that the entire state has been put in and the resiliency that showed. And I think gratitude and like having gratitude for what you have is definitely one way to do that. But I'm curious, among hospital staff in the positions that they have been put in, what are some things that the state has done that you've seen hospital staff do to stay resilient and to keep going and kind of keep showing up every day?
I think, well, number one, I think is probably prayer. Prayer for what they do have, which is sometimes health. Sometimes it is the roof over your head. So I'm going to put that out there first. Supporting each other. They, as I said, they know there's a coworker or somebody's family who's worse off than themselves. So I think to make sure that they support each other and pick up the slack, whether they can or not, they at least try to support the hospital systems. In some of the areas, they've rented thousands of hotel rooms. And in some of those areas, those hotels had no power. So the hospital systems themselves purchased the generators to put power to the hotels so that their staff members could have a place to go sleep and could have a place to go take a bath for those that had lost water. So the hospital systems have done that. They've also provided some monetary grants to affected employees to try to get them to be able to go buy more clothes or whatever it is that they need at that immediate time. And then from LHA's perspective, we also set up, we've done this in previous disasters, set up an employee care fund where people can donate to the care fund. And then the hospitals themselves will submit applications for their affected after they've validated the affected staff. And then LHA however much funds were collected, they will distribute that across all the applications so that everybody gets something, knowing that it's not nearly enough to replace what they had and what they've lost or what they're going through at that time. Mm-hmm. And, a little levity, I think. We have one CMO that was presenting on a national call that invited anyone who was looking for something other than COVID to come to New Orleans because he hadn't thought about COVID in a week. So I think to make a little levity out of the situation kind of keeps them from just completely crumbling. But I mean, that said, they're struggling. They're struggling watching the patients they cannot save. They're struggling watching the patients that died waiting for a higher level of care. And then the family members that are left in that wake. They're struggling watching coworkers that have died or been extremely sick. But those are the stories you hear across the entire country. But it's sad.
Yeah. Absolutely. But I mean, the incredible amount of support that is there too, I think it says something about the community and state of Louisiana. But yeah, there's no escaping kind of the sadness that surrounds it as well. I'm curious, Libby, when it comes to the community perspective and yourself personally, your family, what are some things that you have done to cope or that you've seen community members do that have really showed resiliency over the last year and a half or even most recently?
So like I had said before, Michelle sees the hospital side, I see the pre-hospital side.
Right.
And not only is the hospital side really, really bad, so is the pre-hospital side. Patients calling for 911 and an ambulance, and we simply cannot take any more phone calls. I mean, our ambulance crews literally, with the storm, not only do they work 72 hours at one point, through the storm, before, during, and after, and put all of their selves and their families on the back burner because they are first responders, and because we are lifesavers, and that's what we do. And so not only did their things go on the back burner, but you really, really saw a sense of community down in the South, in the Houma, in the Thibodeau area, where these sheriff's departments, like literally, all of the people, all of the sheriff's departments from all over, they would take turns and they would cook for our first responders. They would cook for our nursing staff. They would go and deliver these meals to the tent set up hospitals. So it was really, really nice to see. I know our company in general, we have like an emergency vehicle where they can, we have a capacity to, I think, transport like 12 patients at one time. We also have a facility that they can wash and shower. So that really gave some sort of community, and just everyone knows that a good shower and a good fresh pair of clothes is so important, especially during these times. So that, again, they're calling 911 and they're thinking that, okay, I'm going to call 911, so I'm going to get to the back faster and I'm going to get treated faster, when in reality, they're sitting on our stretchers for hours at a time. So it's taking up the ambulance personnel, it's taking up the emergency personnel, it's taking up, so that we're even backed up as well as the hospitals. So it's just a really bad trickle effect, that we've seen. But community, you can't beat anything in Louisiana about community. We love hard and we laugh loud, and that is, I swear that is our state's got to be our state motto, because it doesn't matter your color, it doesn't matter your religion, it doesn't matter what kind of, financial background you came from. Anybody and everybody will do the best that they can and give you the shirt off of their back if that's what their neighbor needs. So I can commend Louisiana people, in that aspect, for coming together to really, really put a good foot forward and supporting these disaster victims, along with even COVID victims, that, you'll see a lot of compassion here lately.
Yeah, absolutely. I love that sense of community. And I appreciate you bringing this unique perspective, because I think we often forget the in-between of when something happens to a person and when they become a patient in the hospital. So I think it's really interesting to keep that in mind, and understanding kind of the position that EMTs are in, and you've been in too, and the companies like yours that you work for. So I really appreciate that. And so I'm curious, I'll start with Libby and then go to Michelle for our last question. I'm going to kind of combine the two, but Libby, what is the biggest resource that your community needs that you've seen, or what ideas do you have that will help communities continue to recover in Louisiana?
So I did forget to say this. I do have a daughter who is severely immunocompromised, who cannot receive vaccines. She has not received any newborn vaccines. She doesn't receive flu. She simply does not have the immune system to support any sort of foreign anything injected into her body. So unfortunately, my daughter, who is, we monitor very closely, she does have a life-threatening disease, and she cannot receive the vaccine. So as what we as a family do, you can ask my husband, I mop twice a week. Nobody comes in with their shoes on. My older kids come home from school and they immediately go into the shower, and their clothes go in the laundry room. So we really, as a family, have had to take it and bring it into our own household, whereas, not everybody else would have to go that far. But so what I see, to go off of your question of what our community needs, let's say, so for the special needs community, I can speak on that because I've seen this. And whatever the special needs community needs, they will find a parent that will find an option, or find an answer to their question, or find the resource they need, or find if they need diapers, diapers come out of the woodworks when something happens, but any other time we're hoarding our diapers, you can't have our 8 diapers, that we get a day. So it's just amazing. Our community is super amazing. I do know we have another affected family by the same syndrome of my daughter down in Homa, and they lost everything, absolutely everything. And so they have 3 kids with the same syndrome as my daughter. So that's 3 times the, amount of stress that this poor mom is taking in. And I know our family has done everything that we can to have, even financially help them, as far as like washing clothes, going and just kind of gutting what we could with them. We really just kind of, whatever they need, they all they have to do is ask. And I know even asking sometimes is really difficult, especially for, a family who doesn't ask for anything. So prayers, I guess, would really be the biggest. That everybody can use prayers, and God answers those prayers, and or whatever belief you have, somebody answers those prayers because it's something happens. So and then just consideration, our community, we really need to continue to have the consideration for everyone else around us, because it's not just about you. It's about this mama who needs to go to Walmart to grab the only type of apple juice that her daughter that has a immunocompromised system needs. And I just need that apple juice, and I'm going to wear my mask, and I'm going to not even use a basket, and I'm going to run in and I'm going to grab the juice and I'm going to run out, and I'm not going to talk to anybody. So it's really the consideration, continuing the consideration and wearing your mask. And if vaccination is your route, then make sure you're vaccinated, make sure your friends are vaccinated, and really being considerate that there are people that are really trying to keep their loved ones alive.
That's well said, Libby. It sounds like what the community needs is that sense of community. And I think it's beautiful that Louisiana has that. And so Michelle, on the health system side, from your perspective, what's the biggest resource that health systems need, and other ideas that you have to help health systems, especially in Louisiana, continue to recover?
I'll say probably the biggest resource is staffing that they need, but not that anybody can just put a nurse or a physician out there and or respiratory therapist. It's like, okay, just because you stayed at the Holiday Inn doesn't mean you get to be one. Outside of that, I think it's compliance with the protocols, with what people are asking you to do. Patients from the communities, from the families, from the patients themselves, just all around. They're doing the best they can. Some of these workers have not had days off in 2 years and are working these exorbitant shifts trying to cover. So I think that's probably, from a resource perspective, I think at the moment, especially in Southwest Louisiana, it's more personal resources than hospital resources. So I think that's probably the most, they just need, some stability. They need power, they need water, that kind of stuff. But I would say probably the most would be the compliance with protocols. And what I think that your group can help with is probably getting people to speak up and stop sharing and start sharing valid science and stop that misinformation. And a lot of people are like, oh, I don't want to say something. When you hear something completely off the wall, speak up. If you have a valid point, then speak up after that.
Yeah.
Our systems will recover. I mean, we've done it before. We will do it again. They will recover. We need a tropical break.
Yeah, I think we all do. Yeah. Absolutely. Well, thank you, Michelle. And I am with you, and I hear you on speaking up. I think it can be really easy for all of us to say, like, I don't want to hurt anybody's feelings, or I don't want to come off the wrong way, but I'm with you. And I think we all need to take a stance in one way or another and stick to it and provide information that is trusted and that resonates. And that was one of the reasons why I wanted to do this this month, is because I have been grabbing resources anywhere that I can and just been pulling it together. And I'm like, how can I get this out to everyone? So, any other resources that you have from your state, I would love to spread and get out there as well. But I would love to thank both of you for taking the time and really shedding light on the current state in Louisiana and what's been going on. I really appreciate you joining and sharing your perspectives and ideas. It's been really eye-opening. So thank you.
Well, and Lindsay, I'll speak to Dr. Katie's, and I saw somebody's comment. Yes, it should be a PSA. I think that is the aspect that the general public doesn't get. They drive down Essen Lane and they see that massive hospital there and they're like, how can they not have any beds? So I think that was the first time that people put it in perspective. And what our media in Louisiana has done better now than they did in the original was sit there and say, we had this massive accident and we couldn't place those people. We had a shooting here and those people couldn't get surgery. You had somebody recognized, well-known in New Orleans, that had a massive heart attack and they couldn't place them. The media has done better of getting those stories out to get the public's attention instead of just saying, oh, we're full.
Right.
I think the more of those things that happen and puts it out in the public space, I think is a win.
Right. Absolutely. I agree. Well, we'll continue to do everything we can to get that message out and encourage all of you to as well. And I think at this time, I would like to just take a few minutes. I know we have about 13 minutes left, but want to hear from everyone else on either if you have questions for Libby and Michelle or a response to these questions. I really just wanted to open the door and hear what all of you are doing, where you're partnering to support your health systems or communities. What other strategies can we use to build resiliency within health systems and among each other? So I open it up. I have a few in my notes that I'll bring up, but just wanted to see if anybody would like to speak up first.
Lindsay, it might help if the systems themselves just ask. I have a sense that many hospitals and hospital systems are so wrapped up in their changes of executive leadership, all that other thing brought on by unknown factors anybody could plan for. So we have what we have. And I thought the Louisiana folks don't need to be asked. It seems to be part of their DNA. But some parts of the country, they just need to be asked, hey, help us. Right. A lot of PFAs aren't being asked because the system is all wrapped up in survival mode or bordering on it. Just a thought, not to be negative, but.
Oh, no, I hear you, Joe. And I think on the other side of that too, for people like us in our positions as patient family advisors, maybe instead of waiting for the ask, it's saying, hey, I'm here. What can I do? On the other side of that. So I think it goes both ways, but I definitely hear where you're coming from. They're doing their day-to-day too and forget that ask. Bill, I see your hand raised. Thank you for using that.
Hey there. So I was on a call yesterday. It's actually a conference with the Minnesota Department of Health for public health people throughout the state. And there were like 350 people in this conference. And it was all about resiliency. Public health people all across the country have been just inundated, and confidence in public health has gone down this last pandemic year or so. They were used to being viewed as somewhat experts in public health, but because of all of the misinformation that is out there about COVID-19, they have not been regarded as experts in their field many times. So they're feeling pretty beat down. So this whole conference yesterday was about that, about resiliency. And some of the key takeaways there were really simple things, but things that we all have to do during this is pace yourself.
Mm-hmm. Mm-hmm.
and do things that you're not necessarily familiar with or comfortable with, but try something new. So a lot of personal things for people who are in the public health sector. So it was really good. And they recorded, of course, but I don't know if the recordings are available to people outside who are not part of that or not. But if they are, I will certainly let you know.
Yeah, please share. I would love to see more about that. But I really like that kind of pacing yourself. And I think that can apply to so many different positions, even individually.
And don't be too hard on yourself, that you and your colleagues are doing the best that they can with circumstances that they're in.
Yeah, absolutely. That's a great reminder. Thank you, Belle. Any others? Mary. Oh, Mary, you are muted.
There. My issue is that I'm hearing all of our hospital issues, which I'm very aware of. And I know we hear about it every day, but where is it that the individual, like just myself or each individual that is presently, how can we stop? We have to get to the root of the situation. The root of the situation is going to be helping our hospitals. And the only way I can see it happening is for each individual to be able to contribute. When you see somebody without a mask or without vaccine, or someone that makes a comment that you've heard maybe a fact, like I heard the other day from the Attorney General. He said infertility is not the issue at all here. So I videoed it. I put it on my phone and I says, okay, anybody says that, I'm going to show them. This came straight from the Attorney General. How does an individual like myself interact with the public? You have half wearing masks, half not, probably in the same modem as half with vaccine, half without. Yet we have to get to the root of this to get people to work together to understand that it's not all about just because you feel this way or I feel this way, but how can we work together as a general public to get, to slow this virus down so our hospitals aren't overwhelmed.
Right. Yeah, I think that's well said, Mary. And I think we can learn a lot from Puerto Rico, for instance, and even Louisiana, but that sense of community and connection to others. I feel like that's something that's so ingrained in a lot of us, is that kind of individualism. Kind of it's about me and me only. If I'm good, then I'm good, and I could care less about whatever else is going on. I think that's a real issue, and I think any way that we can continue to try to bring this sense of community among us and other community members. Again, I think there's a lot that we can learn from those who are tight and care about each other.
How do I get rid of this no that I put up there?
I don't know. I think it'll go away in a minute.
I hope it does. Thank you.
Yeah. Thanks, Mary. All right, Janice, see your hand raised. You're muted. Janice, you're muted.
Okay.
There you go.
So Mary, I agree with you 100%. And I wrote about this a little bit in the chat earlier, that I think, I don't think we really understand. What's happening is beyond reason. It's beyond reasonable thinking. The fact that, for example, there's a lot of information where I am of the people in hospitals they weren't vaccinated. They're in the hospital sick with COVID. And that still doesn't seem to change people's thinking that is based in what? Like you're saying, Lindsay, that we're so separated that we don't have this community feel like we do in Puerto Rico, but then it's kind of like, it seems like we have to have maybe a meta effort to try and deal with this. And that I also believe there's so much power in storytelling. Maybe if there's smaller groups of people or maybe even smaller communities where one of them is sitting on the fence a little bit and they're trusted by the group, can tell some stories. I don't know, but I think we're not addressing that seriously enough, that whole facet of this dilemma. And right, we're not going to get beyond this until there's a certain level of vaccination. And it's, I don't know, I just feel like we're not, the grand we're not talking about this very much. We're struggling so much with dealing with the daily horrors, of course, and that's taking so much time and energy. So I'm just wondering what anybody else thinks about this.
Yeah, thanks, Janice. I think that's a great point of sharing the stories. So like Dr. O'Neill's video that we shared in that story, and I've seen a few videos of individuals who were previously against getting the vaccine talking about why they got it. And I think those are the most powerful, especially for those who are on the fence about getting it. But yeah, it's just sharing every chance that you can get. But absolutely, I agree that story sharing is absolutely transformative. So to do that whenever we can.
I have the impression, and I may be off base, the doctor speaking in that video presented herself very well and very rationally, and she gave us information, but I don't think that's going to land on anybody who's anti-vax.
Right.
You know, that's some kind of authority that they don't respect even. I'm generalizing, I realize that.
No,
I'm just trying to find a little new path to go down.
Yeah. I think we are all fixers and want to find that path as well. So as long as, like you said, we continue talking about it, we can continue to move on that path. I am going to go to Barbara, and then we're going to have to wrap up. Sorry, Dr. H, but if you can put your comments either in the chat or send me a note, I'll add them to our wrap up. But go ahead, Barbara.
I think we need to, we shouldn't be talking about anti-vaxxers. I think there's a segmentation of that population. And there are people who under no circumstances will get a vaccine. But I think there's a very large middle ground of people who might be curious. Or as an example, I live part-time in ivermectin country, where that's what most people believe in. We have someone who we're building a relationship with, getting friends with, who's a gardener and who will be working with us. And through the relationship, I think the relationship is the channel through which curiosity could be expressed, questions could be asked, rather than doing a correct data dump.
Right.
I don't think that has influence. I think relationship has influence, and through relationship and through genuine caring and curiosity. And this person, as we got to know him a little bit and said to him, "So you're not vaccinated? What are your thoughts?" He said, "Well, I'm not against it, but I haven't gotten around to it yet." And that opened up a larger conversation. And we asked his permission to nag him every time we see him. And he said, "Sure, that would be great." So I think we have to segment and build relationship. And I think the other thing we can do, which has a very powerful impact, is when we have connections, contacts with healthcare providers, to make sure that we share our appreciation, our gratitude, our compassion. That can help put a few more drops of water into what is a quickly emptying well of compassion fatigue that they're suffering. So I think those are two avenues.
Yes, yeah, that is great. Thank you, Barbara. I think really well said. And I know you have a lot on kind of relationships and coping. So anything that you can share that we can continue to spread, that would be greatly appreciated. I have kind of put together a resource list that I will share. I'll add a few of the resources that have been shared in the registration. And if you have any other resources that you would like me to add, please email them to me, but I'll send this out along with the recording of our session today and all of the links that we reviewed today. But again, I encourage all of you to continue these conversations. I really want to thank Michelle Smith. I know that she had to jump off, but thank you to the Louisiana Hospital Association so much for everything that you do, but also for participating today. And thank you, Libby Airhart, also for everything that you do as well, and for joining us today. And thank each and every one of you for continuing to show up and collaborate and be part of the solution. I hope you all have a fantastic weekend. Stay safe, and we'll see you next time. Take care, everybody.
Bye. Thank you.
Bye.